This presentation is being made for Aspen University School of Education for course RSH 916, Problem-Based Research and Action. Module is 5, and it is on Defining Topic of Interest by Tim Smith on April 1st, 2024 for Dr. Christopher Mangan in course RSH 916. Section 1 is on the research problem. Section 2 is the goals of the research action research plan. Section 3 is on the stakeholders and participants. Section 4 is on potential obstacles and remedies. Section 5 is on a potential solution. And then Section 6 is on metrics used to measure the effectiveness of the program. Section 1, research problem. So the research problem is to find a way to do cost-effective AR/VR training programs for medical education, looking at ways of using generative artificial intelligence, or Gen AI, based on a robust large language model approach for one of the commercially available tools to help generate storyboard scripts, voiceovers, and branching for a story-based e-learning program. It needs to use 3D models that are textured, UV mapped, rigged, and ready to go, either sourced as high quality models or built for use in the simulations. And then for cost-effective gear, one of the obstacles in getting AR/VR training out to facilities and to nurses and doctors in small facilities is the cost of the gear to run the program. Basing it on a smartphone approach opens the door for low-cost headsets with haptic devices to allow for interactions in the scenarios. In Section 2, goals of the action research plan. Rapid environment design with coding using the visual coding tools. Leveraging the power of Gen AI and sourcing existing models to greatly reduce the course development and deployment time so that we can map, build, and deploy courses in a timely manner and be able to have each designer, instructional designer, being able to deploy 2, 3, 4 courses per year in an interaction level 4, highly immersive and engaging program. Now, the next section is on stakeholders and participants. So stakeholders in the organization that I'm in include portfolio manager, integrated marketing manager, marketing automation specialist, the subject matter experts, clinical specialists, the vice president for the pillar to approve the concept plan and budget for the development of the course, and then of course a senior instructional designer to actually build it. Participants can come from a number of sources and can include people from the medical education community, AR/VR community, learning and development community. There's extensive communities available on LinkedIn. When it comes to testing, we can work with internal testers and pilot with a selected region For live testing, once we get to the gold, beta and gold versions of the iterative development cycle, to get feedback and find ways of improving the courseware for all of the learners that will be using it. And then there are dedicated educational gaming communities that exist outside of the standard social media platforms that have a lot of experienced serious educational game developers that can help provide insights on best practices. Potential obstacles include coming up with the right generative AI tools that can perform the way we need them to perform, with good prompts. Some of the prompts that are being used now in the research are 1 to 2 pages long that give detailed specifications for what's needed, so that as each Gen AI tool is being tested, we're comparing apples to apples for the potential of each tool and which one can best meet our needs. Then sourcing the 3D models for the general environment and standard equipment. There are lots of models available already for patented and trademarked devices and practices that are used with our services. We would either have to build it or work with an in-house shop to have those trademarked devices modeled with the right interaction points, like if it has buttons or settings that need to be set on the device to use it properly, and then map consequences of improper settings to be able to use those. And then there's the environment design. Environment design has rapidly improved over the last several years, and there's visual coding tools now available to allow you to do minimal or even no C# or C++ coding now to design the interactions. If there is coding needed and it's beyond the capabilities of our current staff available for building these, then we could hire third-party coders as needed. Now, solutions that we're looking at: being able to deploy these courses rapidly will allow us to align with the campaigns being developed by the marketers, so that they can have these tools in the hands of the healthcare professionals as they're promoting these campaigns. They have to be highly interactive and immersive. They have to use advanced branching, and they need to get away from standard pop-ups that say, sorry, that's wrong, or yes, that's correct, and show realistic outcomes of their choices. So if they do a setting wrong and it causes an infection, have the scenario show an infection developing for the patient so that they can take corrective action. Now, metrics to be able to show the efficacy of doing immersive training over typical e-learning. For the pilot, we would build the course twice. One in the immersive environment, and then the other one with advanced branching and interactions with a level 3, interaction level 3 course. Both of them would have pre-tests, have the same content. They would be presented differently because one would be immersive and the other would be in a 2D environment. And the post-test, and we can measure where the current competency level is at the start of the course, and as they progress through it, and their competency levels at the completion of the course. And we can see how well the course helped them to learn and achieve the desired learning outcomes. Now, in conclusion, AR/VR has been proven to be highly effective at training people, upskilling people, helping them to learn how to do the functions in realistic environments. It's used for pilots and medical emergency response personnel. So it's an effective tool, and we just need to be able to build them quicker and get them rolled out in a timely manner to help our healthcare professionals. Sources are on the reference slide, and thank you for your time.